Once more, I'm going to continue. We're going to get into exercise now with lifestyle. Why don't I take metformin for longevity? Okay. And the reason why is because metformin acts on certain things that have to do with type 2 diabetes. These same things are more easily and more safely and more effectively dealt with through diet and exercise and other lifestyle modifications. So back to basics with active lifestyles. Exercise is more effective than metformin to reduce cardiovascular risk in older adults with type 2 diabetes. Okay? So let's take a look here. This is the introduction, blah, blah, blah. Okay. The most prevalent comorbidities were hypertension at 93%, central obesity, meaning abdominal fat, at 74%, and hypertriglyceridemia, meaning high fat, which was high fat in the blood, which would be 64%. The three therapy groups did not show significant differences except for the metformin group had more males, was younger, heavier, and had lower I guess that's a triglyceride, whatever. Okay, and met group. Okay, evaluation of differences. At 24-month evaluation, several significant differences were found. Differences between the next met group. Okay, blah, blah, blah. Let's see what the conclusion is. Discussion. The main finding of this longitudinal study of older adults with type 2 diabetes and comorbidities in the early stage of the disease is that exercise was the most successful. Okay, exercise was the most successful and effective therapy to reduce cardiovascular risk, demonstrating the relative single value of exercise is a multifactorial intervention. These results are consistent with previous lifestyle interventions which produced long-term benefits. So for body mass, cardiovascular risk, and etc. The majority of patients with type 2 diabetes are overweight or obese, but weight loss has been shown to improve glycemic control, diminishing the risk of the progression of type 2 diabetes in overweight and obese adults. In fact, even decreases as small as 1 kilogram or 1% of the body mass can benefit glycemic control, morbidity, and mortality. I forgot the Y on mortality, apparently, which means that the reductions in okay, so there we go. So exercise, going back to the top here, exercise is more effective than metformin to reduce cardiovascular risk in older adults with type 2 diabetes. Okay, which means it's more effective than metformin to reduce cardiovascular risk in older adults and all adults that don't have type 2 diabetes, or at least I think that would be safe to assume. So for longevity, it seems that it would be more beneficial and less risky to just exercise. Over long term, diet and exercise are best to prevent diabetes. Okay, in a head-to-head comparison over 15 years, diet and exercise outperformed the drug metformin in preventing people at high risk for diabetes. Okay, so from a longevity standpoint, taking a drug that prevents diabetes, it's more effective because in a head-to-head comparison for 15 years, diet and exercise outperformed the drug metformin in preventing people at high risk for diabetes from developing the disease. Metformin, which helps control blood sugar and can be used alone or in combination with insulin to treat type 2 diabetes, also lowered the risk of developing the disorder in the study group. The lifestyle intervention was more powerful in preventing or delaying diabetes. development during the original 3-year diabetes prevention program and remains more powerful over the entire 15-year study, said this dude. However, there are specific subgroups in which the lifestyle intervention had an even more powerful effect. So there are some where it was even more powerful than metformin, specifically those older than 60. Okay, the researchers followed up with the surviving participants of a diabetes prevention study between 1996 and 2001 that compared people randomly assigned to either an intensive lifestyle intervention or 850 milligrams of metformin twice daily and a group taking a placebo. The participants were all overweight or obese and had elevated blood sugar levels, both factors that put them at very high risk for developing diabetes. At the end of that study, the people following the lifestyle intervention, which included a low-fat, low-calorie diet and 15 minutes of moderate intensity exercise daily, had a 58% lower risk of having developed diabetes compared to the placebo group. So that's 15 minutes of moderate intensity exercise daily. Okay? This isn't some crazy marathon or powerlifting that these people are doing. This is like walking or stretching. You know what I'm saying? This is not some crazy exercise program. Since the lifestyle intervention had worked so well, all participants were offered a version of it for 1 year after the study concluded. As of 2014, almost 90% of the original group, or 2,776 people, had been followed since the end of the first study, and based on their original group assignments, they were offered lifestyle reinforcement seminars twice yearly or continued to receive metformin. After an average of 15 years, diabetes incidence was lower by 27% in the lifestyle intervention group and by 18% in the metformin group compared to the placebo group. Okay, in 2014, 55% of the lifestyle group, 56% of the metformin group, and 62% of the placebo group had been diagnosed with diabetes. Okay, let's move on here. So this is from the American Diabetes Association, and this is going to talk about the benefits of walking for type 2 diabetes. Okay, so you don't need any special equipment, clothing, or even shoes to begin walking for your health, but it may help you stay motivated if you wear comfortable clothes and shoes. Pick a safe place to walk, okay, how walking helps you, okay? When you do aerobic activities regularly, over time, you can see many health benefits. Blood glucose levels go down, insulin sensitivity goes up, heart health improves, metabolism increases, weight loss or maintenance becomes easier, balance improves, blood pressure decreases, HDL cholesterol increases, LDL cholesterol decreases, your mood is better, you feel more focused and alert, memory and cognition improve. How to get started safely? Okay, you can read this on your own. Other easy ways to walk more: walk instead of driving to nearby destinations. If driving, park a bit farther away from your destination. Get off the bus or train at a farther stop and walk the rest of the way. If you have a dog, walk it daily or offer to walk a neighbor or friend's dog. When traveling, take walking tours to see the sights. Start or join a walking group in your neighborhood. The benefits of strength training for type 2 diabetes. Compared to women who reported no strength training, women engaging in any strength training experienced a reduced rate of type 2 diabetes of 30% when controlling for time spent in other activities and other confounders, a risk reduction of 17% was observed for cardiovascular disease among women engaging in strength training. Participation in both strength training and aerobic activity was associated with additional risk reductions for type 2 diabetes and cardiovascular disease compared to participation in aerobic activity only. Conclusions. These data support the inclusion of muscle strengthening exercises in physical activity regimes for reduced risk of type 2 diabetes and cardiovascular disease independent of aerobic exercise. Further research is needed to determine the optimal dose and intensity of muscle strengthening exercise. Okay. What about stretching and type 2 diabetes, I mean, that is probably the most passive form of exercise that you can get. So passive static stretching occurs when sustained tension develops within a person's muscle through external forces. Several studies suggest passive stretching can increase cellular glucose uptake, according to blood glucose levels, could decrease following a program of successive sustained muscle stretching. The baseline characteristics of patients are shown in Table 2. There were no significant differences in the baseline characteristics. There was no significant difference after the intervention. However, H1A1C levels decreased significantly in the passive stretching group. Okay, discussion. As mentioned above, this study determined the effect of passive stretching on blood glucose levels in patients with type 2 diabetes. The results showed HbA1c levels decreased significantly after an 8-week passive static stretching intervention. There are several possible mechanisms that could explain how passive stretching of skeletal muscles decreases blood glucose levels. According to a review, glucose transport into skeletal muscles. Other studies also support the possibility of stretching-induced incorporation. Blah, blah, blah. The results of this study are subject to several limitations, of course. Okay, let's move on. Now, there are, of course, many different geroprotectors that have an effect on blood sugar. Okay. A lot of people like to talk about berberine when it comes to metformin. What about cocoa? I don't know of anybody that likes to drink a nice cup of berberine. But what about cocoa? Effects of cocoa antioxidants in type 2 diabetes. Okay, let's see here. So cultured cell constitute a useful tool to study poorly understood anti-diabetic mechanisms of cocoa flavanols, blah, blah, blah. Cocoa flavanols may improve glucose homeostasis by slowing carbohydrate digestion and absorption in the gut. So it has shown that cocoa extracts and procyanidins dose-dependently inhibit pancreatic amylase, pancreatic lipase, and secreted phospholipase. These inhibitory activities were related to the polyphenolic content in cocoa extracts and the degree of polymerization of cocoa procyanidins, showing an inverse correlation between the inhibition and degree of polymerization. Similarly, found that cocoa liquor inhibited alpha glucosidase activity in the muscle, blah, blah, blah. Deterioration of functional B cell mass is observed during type 2 diabetes, and this critically affects the maintenance. There are various studies that suggest that cocoa polyphenols may protect beta cells against death-inducing damaging factors. So there are various studies that suggest that cocoa protects the beta cells of the pancreas from death-inducing damaging factors. Okay. So it increased cellular ATP production. Okay, cocoa flavanols may also modulate insulin signaling, which is impaired in type 2 diabetes. They also activate AMPK. Okay. Cocoa flavanols may also contribute to prevent the chronic low-grade inflammation of type 2 diabetes. So it helps stop the low-grade inflammation and the oxidative stress. Remember, type 2 diabetes is an oxidative stress disease. Animal studies offer an outstanding opportunity to assess the contribution of physiological effects of consumption of cocoa and cocoa components in different models. Interestingly, supplementation of experimental diets with cocoa has regularly shown high acceptance by the animals and no toxicity, even in chronic studies, for more than 100 weeks within the last decade. Different models for experimentation, type 2 diabetes in rats and mice, have been successfully used in order to study the nutritional prevention and treatment of the disease, and supplementation of the diet with cocoa has proved one of the most effective nutritional approaches. Supplementing the diet with cocoa has proved to be one of the most effective nutritional approaches to preventing type 2 diabetes. Anti-diabetic effects of cocoa in mice and rats. Anti-diabetic effects of cocoa and cocoa flavanols in animal studies. Administration of a diet enriched with 10% cocoa. That's only 10% cocoa for 9 weeks. Okay, when I make cocoa to drink, that's 100% cocoa. Okay? Enhanced insulin sensitivity and increased beta cell mass and function. In particular, cocoa intake prevented beta cell apoptosis, meaning it prevented beta cell death, and enhanced antioxidant defenses to avoid the oxidative damage and reduce lipid and protein oxidative stress. The same treatment ameliorated circulating and hepatic lipid profiles, meaning both circulating and liver fat profiles, meaning less fat in the blood, less fat in the liver. It improved insulin resistance and reverted hepatic oxidative stress by enhancing the antioxidant capacity of the liver cells, okay? So let's see here, collaborated effect of cocoa. Okay. So, furthermore, the same mice model, okay, let's see here. So, it helped to ameliorate fatty liver disease, decreased values of blood glucose. Okay. Let's move on here. Habitual chocolate intake and type 2 diabetes. Okay, in the longitudinal study, compounds in cocoa and chocolate have established cardiovascular benefits, including beneficial effects on insulin resistance, a risk factor for type 2 diabetes. The aims of this study was to investigate the relations between habitual chocolate intake and diabetes mellitus. Cross-sectional and prospective analysis were undertaken on 953 community-dwelling participants, meaning these are people that lived in the community. Their mean age was 62. 59% were women. From the main Syracuse longitudinal study, habitual chocolate intakes measured using a food frequency questionnaire were related to prevalence of diabetes mellitus and with risk of diabetes measured approximately 5 years later. They also examined the relation between diabetes and chocolate consumption up to 30 years later. Chocolate intake was inversely associated with type 2 diabetes, meaning chocolate, if you ate chocolate, you were less likely to get diabetes, okay? Compared to participants who consumed chocolate more than once per week, those who never or rarely ate chocolate exhibited significantly higher odds of having type 2 diabetes. So if you rarely or never ate chocolate, you were at a significantly higher risk of having type 2 diabetes. After adjustment for cardiovascular, lifestyle, and dietary factors, including other polyphenol-rich beverages, however, individuals diagnosed with diabetes prior to the nutritional assessment consumed lower amounts of chocolate at the time of the dietary assessment. So they consumed lower amounts at the time of the assessment. Our findings suggest that there's a relation between chocolate and type 2 diabetes may be bidirectional. Okay, so keep that in mind. Chocolate consumption decreases your, basically it decreases your likelihood of developing type 2 diabetes. Cocoa compound linked to type 2 diabetes treatment. A compound found in cocoa could help treat or control type 2 diabetes. Researchers have found. A team from Brigham Young University says increased presence of this compound Epicatechin monomers, which are also in tea, but you can get them in chocolate with less of the caffeine, can help boost insulin production and control blood sugar levels. The compound could also help beta cells work better and become stronger. The discovery was made during a trial where mice were fed a high-calorie diet. The researchers found adding the compound decreased obesity levels and also helped improve blood sugar control. Study author, assistant professor of nutrition, dietetics, and food science at Brigham Young University explained what happens is it's protecting the cells, it's increasing their ability to deal with oxidative stress. Epicatechin monomers are making the mitochondria in the beta cells stronger, which produces more ATP, the cell's energy currency, which then results in more insulin being released. While cocoa is commonly found in chocolate, Tessim stressed eating high quantities is clearly not the answer to achieving better blood glucose control. However, drinking cocoa in water with an artificial sweetener, like I do, might just be, okay? Which is why the study team is looking at ways of extracting the compound from cocoa. Maybe, I don't know, you could make it by putting cocoa powder in hot water with an artificial sweetener. This way it could be used to develop future type 2 diabetes treatments. Okay, and I'm going to move on here. So we talked about exercise, and we talked about cocoa, and we talked about diet, and we talked about all this good stuff, and we talked about glucose control. What about meditation and the control of blood sugar and cross-linking? Well, let's take a look. At the end of the study, significant decrease was seen in patients who practiced meditation as compared to the other group. Conclusion: meditation may modulate the physiological response to stress through neurohumoral activation, which may be a novel therapeutic target for the treatment of CAD, introduction for coronary artery disease. Okay, so coronary artery disease is the leading cause of death worldwide, blah, blah, blah. Okay, let's go down here, see what's going on here. Meditation is a set of attentional practices, yada. The meditation technique was to sit in a relaxed stance on the floor. Patients were asked to focus attention on their bodies, asked to put their attention at the area of forehead and just sweep the body, feeling every part of the body, sensations and tensions. If they felt any tensions in their body, they were asked to just be aware of those tensions. Do not try to resist or control those tensions and continue sweeping the body. Concentration on breathing. Patients were taught to allow their body to breathe naturally and focus their attention wherever they feel the sensation of breath in the body while inhaling. Be conscious of inhaling. When exhaling, be aware and be conscious of exhaling. Be with this movement of the breath. Just come back to it as an anchor. Distress to de-stress. Patients were taught that whenever they experience tension, stress, or anxiety, try to focus their attention on other things. Perhaps the sounds they hear, the sensations in their body, the touch of their clothing, movements in their body, their heart beating, or the rise and fall of the abdomen during breathing. They were made to learn to be aware of other things that were happening while they were experiencing stress. Forgiveness. Patients were taught to gently soften their thought towards themselves, accept themselves as they are, without any notion of what they should become. Making friends with those with whom they really feel that friendship, that kindness, then only they can extend their friendship, gentleness, softness, etc., blah, blah, blah. Follow up. All patients were directed to fill up the requisite information with respect to the medication prescribed, yada, yada, yada. Results, name of the software used was the analysis is IBM SPSS, Statistics Data Editor, manufactured, okay, whatever. All 60 patients were taking medications as prescribed by their cardiologist, which included Okay, discussion. Coronary artery disease remains one of the major causes of morbidity and mortality worldwide. A number of risk factors have been identified to be strongly associated with coronary artery disease. Diabetes and stress and behavior patterns are one of them. Hence, the present study was chosen to study the effect of a stress-relieving technique, meditation, on biochemical parameters of coronary artery disease. Okay, when one is exposed to a physical or psychological stressor, the brain initiates a stress response from which a series of chemical reactions ensue. The stress response is a healthy defense mechanism and involves the release of hormones that have numerous biochemical and physiological effects. However, the continued release of these hormones under conditions of chronic stress can have detrimental effects on health. Indeed, the hormonal response associated with long-lasting stress increases the risk of many diseases, including heart disease, stroke, and angina. Stress hormones also trigger increases in blood pressure, heart rate, and blood sugar, and raise the risk of heart attack. The present study was conducted in the departments of physiology, biochemistry, and cardiology. And at the end of the study, it was seen that there was a statistically significant decline in fasting blood sugar levels. Significant decline in blood sugar levels in patients practicing meditation. Okay, as compared with those not practicing meditation. The statistical analysis showed that the differences were highly significant. However, there was not such finding in the non-meditating group. Cross-linked hemoglobin also showed statistically significant decline in the meditation group at the end of the study. Medical meditation of Dhram Singh Khalsa has claimed managing diabetes, both type 1 and type 2, by strengthening the pancreas, which regulates the body's insulin level by increasing blood flow to the area. Recently, a group of researchers at General Hospital in Bangkok studied 50 men and women 42 to 80 years of age, over a 3-week trial during which time they measured the blood glucose after eating breakfast. This was followed by meditation with significant improvement in post-meal blood glucose level. These results suggest that meditation may modulate the physiological response to stress through neurohumoral activation, which may be a novel therapeutic target for the treatment of coronary artery disease. Previous work by this person has suggested that is linked with sympathoadrenal system, so the sympathetic nervous system that releases the adrenaline is responsible. It's linked with coronary artery disease. Visceral obesity, insulin resistance, and diabetes are also associated with a pro-inflammatory state that is linked with elevated coronary artery disease risk. The present study results expand this understanding and demonstrate that meditation, not heavy exercise, meditation, which is believed to reduce the sympathoadrenal system activation, beneficially alters the insulin resistance components of the metabolic syndrome and hence reduces coronary arteries disease risk. These current results also expand on our causal understanding of the role of stress in the rising epidemic of coronary artery disease. Although current low levels of physical activity, unhealthy eating habits, and resultant obesity are triggers for this epidemic, the demand of modern society may also be responsible for higher levels of chronic stress. Stress activates the neurohumoral system, specifically the sympathoadrenal system and the hypothalamic pituitary adrenal axis that involves catecholamine release, vagal withdrawal, cortisol secretion, and upregulation of the renin-angiotensin system. Acute psychological stress has also been demonstrated to increase interleukin-6 levels, possibly owing to stress-induced catecholamine activation. Interleukin-6 also appears to activate the hypothalamic pituitary adrenal axis, increasing the hypothalamic secretion of corticotropin releasing hormone and responsiveness of the anterior pituitary release of corticotropin and adrenal secretion of cortisol. So it helps to release cortisol, which causes abdominal fat, which is linked to diabetes. There is tremendous enthusiasm in cardiac rehabilitation circles to incorporate complementary forms of exercise therapy such as yoga and meditation to the mainstream practice of cardiac rehabilitation. Lack of infrastructure, lack of expertise, and lack of funding seem to be the main hurdles in the implementation of such reform. Therefore, more research needs to be carried out at leading rehabilitation centers into the benefits of complementary physical exercise modalities, and a push for more funding is required once there is unequivocal evidence of the benefits of its incorporation into the mainstream post and pre-event cardiac rehabilitation. Okay, and that's going to be all for this video series, I think.